Today we're going to start a very important topic, another topic which is oral hairy leukoplakia. So let's start. Bismillahirrahmanirrahim. So basically, first I have teach you the hairy tongue. It was oral hairy tongue. Now we will discuss about the oral hairy leukoplakia. So it is basically common in HIV patients who are infected by HIV or Epstein-Barr virus. Okay, the patient have and then moving towards how it looks. So the picture which I want to show you, it's very clear, from which you can learn it also. So number one, the location is the lateral border of the tongue. It is basically okay. Now they have a very thick white mucosal plaques. Okay, then they have actually a faint white vertical streaks. Okay, and they are thick and furrowed areas. Okay, they have also a shaggy carotid surface. Shaggy carotid surface is basically, again, it is the thick surface, thick carotid surface it is. Okay, they have no they are very extensive, which you can have seen, and it can be also present on other sides also. Now, hyperkeratosis is present and corrugations. It is not a very continuous symmetrical. Okay, ecnotosis is basically the edema of the spinous layer. Band-like zone, you will see it. What is band-like zone? Basically, the spinous layer, the upper spinous layer cells will take lightly stained, and these stains are taken by the balloon cells. So it appears like a band-like zone. Okay, so what is a band-like zone? Band-like zone is occur when the lightly stained cells, balloon cells, which is present in the upper spinous layer. Okay, then no nuclear bedding. Nuclear bedding is basically the clumping of chromatin, can also be seen in this. Dysplasia, there is no dysplasia, means there is no changes in the cells. Candidal infestation means you can see also candida infestation, means the candida can also be present. Okay, very important point. This is the histopathology of this. You can see a band like zone is here. Okay, now diagnosis, how you will diagnose it. The patient who are HIV can have this clinical feature, and the definite diagnosis, the patient is Epstein-Barr virus, have this oral hairy leukoplakia. Okay, then how you will diagnose it? Another matter is C2 hybridization. You just have to know what you should just know that we also do C2 hybridization. PCR is polymerase chain reaction, which we do also. Immunochemistry we also do for this. Southern blotting, it is in another method. Electron microscopy is another method for this. Okay, now which diagnosis used for HIV? It is clinical features. For Epstein virus, it is definite diagnosis. And then C2 in C2 hybridization you do, then you do PCR, immunochemistry, then you also do southern blotting, electron microscope. Through also electron microscope you see it. Okay, PCR, immunohistochemistry, southern blotting, and electron microscopy can also be done for this. The other is you will do how to treat it is basically you will give first you don't need any treatment, but you can give the systematic antiviral drugs. 3 drugs, antiviral drugs you will do: acyclovir, valacyclovir, and famiciclovir. Acyclovir given 800 milligram, 800 milligram, for 5 days per day. Valacyclovir, it is 1000 milligram, 3 days a day. Okay, then famiciclovir is 500 milligram, 3 days a day. Okay, in topical therapy, if we have studied the system, in topical therapy you give the podophyllum resins. Basically these are the 25% a solution which the patient it can resolve the lesion after 1 to 2 treatment of application. It is a cellular cytotoxic. Podophyllum, podophyllum resins, 25% solution. When you apply 1 or 2 times, it can resolve the lesion. Okay, retinoid is retinoic acids, which is a when known to inhibit if the patient has Epstein-Barr virus. Okay, it is in vitro and induce epithelial cells replication. Okay, and differentiation. Okay, now surgical excision and carography. For the HIV patient, it is a heart therapy. Okay, so in treatment plans you have systematic, you have three antiviral drugs, which is acyclovir, valacyclovir, famiciclovir. Acyclovir you will give 800 milligram, it is 5 times a day. Valacyclovir, it is 1000 milligram, 3 times a day. Then famiciclovir, 500 milligram, 3 times a day. In the topical treatment, you have podafinil raisins, 25% of solution. After 1 to 2 application, the lesion is resolved. It is cellular cytotoxic. You have retinoic acids, which inhibit the Epstein-Barr virus. Okay. Uh, the replication in vitro and induce the epithelial cells and differentiation. You can do also surgical excision and choreography. And for the HIV patient, it is heart. Okay, we'll give the heart therapy, which is highly active antiretroviral therapy. You give it.